are halfway through the month of January, but remember what we all said at the beginning of the year? New year, new you? Well, a lot of people are trying to improve their health in 2024, but what about your mental health? Have you thought about that? Dr. Willough Jenkins, pediatric psychiatrist at Rady Children's Hospital, is here with more on how we can create some new habits and what we can all do to improve our outlook this year. Dr. Jenkins, thank you so much for coming back. We do appreciate your time with us.
Thank you. And I love that everybody's focused on their mental health as much as their physical health, because I think it's equally, if not more important.
Absolutely.
And I have 5 things, healthy tips for your mental health that I'd love to share.
Yeah, jump right in. Number 1, let's get started.
You got to sleep. Sleep, sleep, sleep. It's overrated and underrated, but as an adult, you have to get at least 8 hours of sleep. It's going to be good for your mood, good for your energy, good for so many things.
Okay, so that's for adults. 8 hours of uninterrupted sleep, which I'm working on. I know I'm up looking at that clock. What time is it now? But what about our kids and teens? How many hours should they be getting?
At minimum 10.
10 hours.
And so many kids are not getting that with homework, late practices.
With the screens in their rooms,
oh, with
you know,
the screens
that's a
in
problem.
their room.
Yeah.
Yes, so prioritizing that and making sure they have that 10 hours of uninterrupted time for sleep is so key.
Because when we don't get enough sleep, what's happening?
Your brain's not working the way that it should be. It doesn't have the time to heal and repair and process and encode all the memories we make. So sleep is vital for our mental health. And that kind of leads me to the next one, which is equally important, but everybody knows: exercise.
Exercise.
You have to be moving your body. Exercise increases blood flow to your brain. We say 150 minutes a week. That's 5 times of 30 minutes. It is doable, and it's so helpful for your mood, for your energy, for your sleep, concentration. Helps with depression, ADHD, reduces substance use. I cannot sing the praises of exercise more.
I started exercising during the pandemic on a regular basis, and it did start out for mental health reasons, and it made a monumental difference. And then you don't have to run a marathon in order to get that achievement.
Just walking, brisk walking is a great place to start, and it's so true. I always say it to my patients. They go, "Oh, exercise again," but the evidence is there. It does help.
It does make a difference. Okay, number 3, what else?
Well, this is the one no one likes to talk about: your diet.
So, what are you going to take away?
So I personally find all the healthy recommendations a little overwhelming, so I keep it simple. Just limit the processed foods and eat more fruits and veggies. If you do that, you're winning. Your diet's going to improve.
Okay.
Get those good nutrition.
Okay, so mental health, we've got sleep, we've got making sure that we're getting enough exercise, we're watching what we're eating. What else can we be working on?
Well, the last 2 are a little bit less obvious. So one is your social connections. You mentioned screens, and we're so on our screens on social media, and it feels like we're connecting with people. It feels like we're with friends. But prioritize at least once a week sitting down with someone in person outside of a work situation and connecting. And we know that that's really helpful for your mental health as well.
Yeah, and it keeps, your friendships need to be strong, and your connections with relatives and your spouse, and that's really important.
Completely, and it's so easy to slip and not be viewed as a priority.
Number 5, and I love this one because I do think that this also makes a big difference in my mornings too. What's number 5?
Number 5 is getting early morning sun exposure.
Yes.
But here's the thing: you have to be outside. You can't be in a window or in a car. Your eyes and your face have to be directly getting that sunlight. And the early morning sun exposure is so key because it helps your body regulate its circadian rhythm, our internal clock. And we know that that's helpful for mood, making sure that we know when to go to sleep, keeping alert during the day. So it's an easy one once you get into the habit of doing it.
I know, and again, if you can combine that with your exercise and make that your 30 or 45-minute walk in the early morning sun, then you've knocked like 3 things off the list right there.
Yeah, eat a banana while you're at it.
There you go. Dr. Willough Jenkins, thank you so much for coming back and for helping us improve our mental health here in 2024. Not too late to put that on your list of New Year's goals if you have not done that yet. Dr. Jenkins, thanks.
You're welcome.
Carla.
All right.